workshop rather than a true planning workshop. Thank you very much.
Thank you so much. Thank you so much, my four speakers. As you narrate how the police need the law are there, it's the need time now to continue to practice what they need. The political will is in place, but what we need as a PPP, both at our NGOs and the part of the government, to collaborate and to ensure that these HIV active services are being delivered at the primary health care. So now I'll welcome for the question, comments, but please hit to the questions. And the base, as they say, the base of our forum is making an impact that matter through private sector engagement in HIV response at a primary health care. So we will be happy if that's a question we base on that line. You are welcome. So can I have a mic? We can start with the last one. And if possible, you can mention that you direct that question to each speakers. If that's possible. If not, you can ask. We can take it general. You're welcome.
Thank you so much, Madam Moderator. My question goes to my colleague, Dennis. You mentioned about the private sector as the biggest regions which you support. What kind of incentives do you use or you extend to the private sector? Thank you.
I think I'll take 3 questions before answer. Okay, that's one.
Thank you very much, Ambrose Mwezi. I serve at BEILSALL as the Region Director. My question is around compliance and regulation from the private sector. The challenges we face in health service delivery, I come from Uganda, is even after the government extending a hand to the private sector, then we have a challenge in managing the quality of services and compliance as per the guidelines, where you see C-section rates in private sector going to 70%, which is way above the recommendation because people are looking at the monetary aspect. So how is the private sector ensuring compliance with the regulations so that it can sustain the services? Thank you very much.
Thank you. Can give the nearby one and then you take the last one.
Thank you very much, the presenters. I would like to direct my question to Dr. Faume. Recently, we heard that there is a prohibition of public practitioners, providers per se, yes, to practice in private sectors. So, if this comes, how will you sustain this? So let us make sure that we reform things and rethink and reconcile and resilient. So thank you very much.
Thank you. I'll take the last hand from this side, the right one.
Asante. Good morning. Still good morning. My name is Joseph from Pathfinder. I would like to direct my question to Dr. Mfaume and to my colleague from the private sector. So we keep on talking about private sector and the public sector. And when I listen to the way we speak about it, I feel like there is a dichotomy of expectations between the private and the public. The private sector is looking at the government as a source of resources. At the same time, the public sector is looking at the private as a source of resources, you know. And I hear the private sector saying we should be involved. We should be involved. What is the meaning of involvement? You know, what does the private sector need from the government, and what does the government need from the private sector when we talk about sustainability? Thank you.
Thank you. I say we'll take that for the first round, then we'll go to the second. I think we can get answers. We'll start with Dennis, and Dr. Mfaume, you have 3 questions. Yeah, thank
you. Thank you very much. Responding to the question, there is no separations between private and public-private in terms of support that we provide. So we as implementing partner, we equally treat public and private to ensure that the kind of service that is provided in private is and public as well is available in private. So as what we do in public, we support HRH. I mean, we have station health workers in private hospitals specific, and I think those bigger ones have even bigger number of healthcare workers that are in private as compared to private. We support training, capacity building. We support them with extended working hours. We patrol the working extra hours. We support internet. We procure computers or electronic gadgets. But in past, we use even to build some of CTC that are in private have been built by in support by implementing partners. And moving forward with this sustainability, now I engaged fully in planning. And the last 2 back years, we had a separate contract to ensure that as private hospital, what do they have special needs that are not available in private that we think we can support. So this is what we do, but with what so far we've done, I think we've been able to achieve what so far we've been able to achieve. So they are happy, and whenever they have concerns, they normally share with us for addressing. Thank you.
Thank you. Let's get some answers from Dr. Mfaume. You're welcome.
Let me start with the last question to me from Dr. Josephat Kamuhangilo, on the way he was following the discussions. The private sector seems as if they have the expectation from the government, and the government has the expectation from the private sector. Do we all know what we need from each other? It's you who have to say what you need from each other. But to my experience, we just need collaboration, working together, mutual trust, planning together, transparency, participation from each other. Sometimes what we need is not much, it's not money. We can need just your technical support, working together, advising each other. On my side, for example, just I was reaching to the research institutions. And what I said, I not need money from this institution. I said my CHMT, Cancer Health Management, has enough capacity in conducting implementation research. So we just need facilitators from your institutions. Have a little money for, and I will use my venue that is available in my office. And I have a little money for tea and refreshment. And I don't need you to pay allowances to my CHMTs. So what we need mainly is, what are our priorities? Do we put first money in everything, in every barrier? Or there are a lot of issues that we can implement without even treating money as a potential barrier? But what I say, we need a discussion. We need a dialogue. There is variety of support, variety areas of collaboration. There are many challenges that when sitting together, having a mutual dialogue, we will find the way on working them. They differ from geographical locations, from the nature and the policy of the implementing partner or private sector, but normally from the government side, there is that uniformity. Maybe you can just find the individual specific behavior. So much of what we need will come from the dialogue, from the official structures, or some dialogue are coming from unofficial structures, but then put into our platform for discussion. Like we have umbrella organization, as I said, after, for example, Association of Private Health Facility in Tanzania, for its facilities. We have umbrella for coalition of organizations, CSOs. But those are not only structures that can solve each and everything. So we need to meet each other. We need to engage each other. We need to listen to each other. Sometimes people forget that listening also is very important in meaningful collaborations. So the other issue is the issue of compliance. It's good, my brother from Uganda, you said the issue of compliance is a problem. I think it's a global problem. There's a difference between